One of the advanced therapies for overactive bladder or the gotta-go problem, especially when medications have failed to control the symptoms, is called bladder Botox procedure. Now, very similar to the Botox of the forehead. It's a similar botulinum toxin, which is injected into the bladder. So it's a very low dose. It's 100 units that's placed in the bladder. It's done completely with the patient awake. It's done right in my office. So patient comes in, we do this procedure. It takes me about 5 minutes to do the procedure, and she's home back to all activities. No restrictions at all. She has minimal discomfort, if any. So very successful at the same time, where over 85% of the women will at least have satisfactory improvement in their symptoms. So the good news is that it could last about 3 months to 6 months, but even if it starts coming back after 6 months, I may have to redo it, but it's such a quick procedure that can be done right in the doctor's office, right in my office, completely with the patient awake, right through the urethra. There is no cutting involved. We go right through the natural urethral tube, do a cystoscopy, look in the bladder, and place the Botox under the bladder lining. The procedure takes less than a minute to actually do the procedure, and the patient's in the procedure room for about 5 minutes and then back home. So clearly a procedure that is straightforward, simple to perform. The risk of retention, whether she cannot empty with 100 units, is very rare. Can happen, but very rare. Risk of bladder infection also is very rare. We give the patient an antibiotic before and during the procedure, but overall the success is satisfactory in a large number of patients. At the same time, if a patient is taking medications, she can continue to do so. So this is a very complementary procedure to medications, or if medications have not worked, this may be by itself successful and we may be able to discontinue the medications also.